Hi, my name is Dr. Stephen Stokes. I own Advanced Pain Solutions in Fort Myers, Florida, and I have a device I want to share with you today that has the potential to completely change your life if you're suffering from back pain, leg pain, sciatica, spinal stenosis, degenerative disc disease, neuropathy, and that is the DDS 500 Spinal Decompression Brace. The DDS 500 brace is not like any other brace you've seen. This device does not inhibit or limit movement in the spine. Instead, it allows for complete range of motion, but at the same time, it decompresses the spinal discs. In your back, between the bones, there is a cushion. It's like a sponge. It's called the spinal disc. And in a healthy back, the disc acts like a shock absorber, and it allows you to move like this, and it keeps the pressure off the nerve. But when that disc gets injured, it begins to degenerate, like this. And the amount of space between the bones becomes less. Now that nerve there gets irritated, and especially movement, walking, exercising, playing golf, dancing, will irritate that spinal nerve root. The results of that are symptoms like back pain, leg pain, sciatic pain, neuropathy, bowel and bladder irritation, all this stemming from the spinal disc. And you know, the studies show that more than 80% of all people who suffer from back and leg pain, the cause of that has to do with degeneration of the spinal disc. So, how do we fix it? Well, if we look at it from a mechanical perspective, if you have compression in the spine, then what we want to do is simply decompress the spine. We want to open this up to alleviate the pressure on the disc and the nerve. If my patients wear the DDS 500 brace for 30 days, what we see is that the spinal disc, like a sponge, begins to absorb blood and oxygen. And that absorption of blood and oxygen promotes healing in that spinal disc. And the studies show that spinal discs do heal naturally if you give them enough blood and oxygen. So the DDS 500, its goal is to increase the circulation of blood and oxygen into the damaged discs of the back. Over the course of several weeks of wearing this, normally for 2 hours a day, we can help to heal and regenerate the spinal disc. And the studies show that that's exactly what it does. We are Medicare providers. That means that if you have Medicare, this device is available to you for little to no out-of-pocket expense. We give a 1-year warranty on the device. You come into our clinic, we measure you and fit you for the device and teach you exactly how to use it. I mean, this has the potential to completely eliminate your pain in less than 30 days. And it's fully covered by Medicare insurance. Why would you not try this? So I want to just show you the device. It's very simple. It looks like this. Wrap it around the waist, right even with the belly button. Put it on nice and snug. Put the secure strap across here. Level it up like this. Then what we're going to do is we're going to take this pump right here. We're going to attach the pump to the hose. We're going to inflate the device according to the specs. As I inflate it, if you watch from the side, you'll notice that it expands. And as it expands, you'll notice that my spine also begins to elongate. We detach the device from the pump, tuck in here, and now our spine is in a decompressed state, like this, opened up. The pressure's off the discs. The discs are allowed to absorb blood and oxygen, which means they're going to heal. The nerves are decompressed. If we have a pinched nerve, now it feels better almost immediately. We keep this on for a minimum of 2 hours a day, and then after that 2 hours, we take it off. We can wear the brace for up to 8 hours a day, but again, this is going to be dependent upon your condition and how much pain you're in. The brace can be worn while you're active, while you're walking, while you're bending, while you're twisting. The brace can be worn theoretically while you play golf, or, while you dance. So the brace is movable. It allows your spine to move. It doesn't restrict anything. It just decompresses it. It feels like you're in a swimming pool. It feels like somebody's lifting you. It's fabulous. Then when you're done, you take the hose out. Watch. In fact, when I fit patients for the DDS 500, I'll usually measure their height before and after use of the brace. And we'll get anywhere from 1/2 to 3/4 of an inch more height in the patient when the brace is inflated. This device has the potential to completely get rid of your back pain in less than 30 days. If you're suffering, or if you know somebody else that's suffering, let them know that this is available. Let them know that Medicare pays for it, and send them the link, please. Thank you.